Hi there, I am Boranbаева Құралай Борашқызы, an English language teacher of Almaty Higher Medical College. Today we are going to talk about infectious diseases. First, I'll give a brief overview of the infectious diseases. Then we'll talk about the ways and methods of transmission of infection, stages of infectious diseases, causes of infectious diseases, symptoms and prevention of infectious diseases. Infection means invasion of the body by harmful microorganisms. Every infectious disease has its own specific way of invasion into a human body. Infection may pass from one person to another through blood, stools, saliva, instruments. It may enter the body through skin cuts, even it may be swallowed. There are intestinal infections which are spread through intestines and stools, infections of the respiratory tract which are spread during coughing or talking, skin infections, and infections spread by living insects. All the infectious diseases are divided in several stages. They are: the first is the period of incubation, the second is the prodromal stage during which the initial symptoms may appear, the third is the stage of a fully developed disease, and the last one is the stage of decline. Causes. Infectious diseases can be caused by bacteria. These one-cell organisms are responsible for illnesses such as strep throat, urinary tract infections, and tuberculosis. Viruses. Even smaller than bacteria, viruses cause a multitude of diseases ranging from the common cold to AIDS. Many skin diseases such as ringworm and athlete's foot are caused by fungi. Other types of fungi can infect your lungs or nervous system. Parasites. Malaria is caused by a tiny parasite that is transmitted by a mosquito bite. Other parasites may be transmitted to humans from animal feces. Each infectious disease has its own specific signs and symptoms. General signs and symptoms common to a number of infectious diseases include fever, diarrhea, fatigue, muscle aches, and coughing. Characteristic symptoms of the diseases may be local and systemic. A sore throat, sneezing, nausea and vomiting, restlessness and prostration, pain in the limbs and back, rash may occur among the most characteristic local symptoms. Recommendations for a medical staff. A lot of disease may begin with these symptoms. It's necessary for medical staff to be careful during physical examination of the infected patients. There are two important steps which mustn't be omitted. The first is to take the temperature, and the next is to examine the throat. A nurse who looks after the infected person must wear a special gown and a mask. She must wash her hands with soap as often as she can. She must be very careful to prevent the spread of the infection. To establish a proper disease, it's necessary to do some laboratory tests at the right time and in the right place. Prevention measures. Follow these tips to decrease the risk of infection. First, wash your hands. This is especially important before and after preparing food, before eating, and after using the toilet. And try not to touch your eyes, nose, or mouth with your hands, as that's a common way germs enter the body. The second is get vaccinated. Vaccination can drastically reduce your chances of contracting many diseases. Make sure to keep up to date on your recommended vaccinations as well as your children's. The third is stay home when ill. Don't go to work if you are vomiting, have diarrhea, or have a fever. Don't send your child to school if he or she has these signs either. The fourth, prepare food safely. Keep counters and other kitchen surfaces clean when preparing meals. Cook foods to the proper temperature using a food thermometer to check for dampness. The next is don't share personal items. Use your own toothbrush, comb, and razor. Avoid sharing drinking glasses or dining utensils. The last one is travel wisely. If you are traveling out of the country, talk to your doctor about any special vaccinations such as yellow fever, cholera, hepatitis A or B, or typhoid fever you may need. I hope this information will be useful. Thank you for your attention. Take care of yourself.